When you have a structure like the human brain that is so complex, it's important to recognize that some things can go wrong. We know how complex the space shuttle is. And when something goes wrong with the space shuttle, it can cause devastating accidents. Did you know that every time the space shuttle flies, something does go wrong? Usually it's just little. It's not a major problem. But if it is major, of course, we all know what can happen. The human brain, being as complex as it is, also can have things go wrong with it, particularly when it's not developed right or it's not treated right by ourselves. And one of the things that results is depression. Depression is not normal, but it's becoming more common. Interestingly, the number of people developing depression worldwide has steadily increased since epidemiologists have been studying this since 1915. Every generation, more depression. Major episodes of depression now occur frequently by age 25. We used to call this disease the midlife crisis. We don't call it that anymore, simply because it's occurring in young individuals at alarming rates. In fact, it's not uncommon for adolescents and even now people 8 and 10 years old, children, developing major depression. I find it interesting that here we are living in a society today where there is more fun things to do than ever before in human history, but yet we have more depression than ever before in human history. All of these fun things, all of these entertainment avenues actually have not solved the problem. In fact, in some cases, they may have contributed to the problem, as you will find out as you go through this mental health education series. I became interested in depression as an internal medicine physician as a result of an article that came across my desk from a prestigious medical journal called the Archives of Internal Medicine. It showed up to 1 in 3 patients that an internal medicine physician sees in an outpatient practice is depressed. And I began to think about that a little bit. I was possibly seeing more depression than diseases of the internal organs that I was trained to treat. An internist treats adult diseases of the internal organs and diagnoses those diseases and tries to get at the root cause. And that means more depression than heart disease, more depression than gastrointestinal disease, more depression than really any other single organ disease. And I began to realize if I'm seeing that much depression, I need to know a little bit more about this disease. In my study of looking at the cause of major depression, I was shocked to find out there were myriads of causes. Not just 2 or 3 or 4. In fact, I found well over 100 different causes that have been well documented in the medical literature for depression. Most of these, I was able to find out, fell into one of 10 categories. Depression is most often a multifactorial disease, meaning that it's usually not just one cause. The brain is pretty resilient. You know, as complex a structure as I've just described the human brain to be, it is actually a very resilient structure, much more resilient than the space shuttle. The space shuttle, if it's missing a few tiles, it's going to go down as it starts entering in. But you know, the brain can have one cause that is operative. It can have 2 causes that are operative. It can have 3 major blows to the brain being operative and still function beautifully well. And that's because we are created with such reserve. But once 4 causes become operative, then that's when the mental health declines significantly. There's virtually one thing that's characteristic of any depressed patient, according to recent literature in PET scans, and that is that there's a 40% decrease in activity and circulation of the frontal lobe in virtually every depressed patient. And recent studies show that this seems to be the primary cause. In other words, the frontal lobe activity goes down first, and then the depression results. We will show you how to improve your frontal lobe function significantly, how to improve this activity, and this being the control center of the entire brain, it will also improve dramatically your ability to be successful from here on out. in life. Wonderful new treatment options began to surface as I began to study this out. And then I began to realize there were general treatment measures. In fact, just as many beneficial treatments as causes in depression. Although many of these modalities have been rigorously tested and proven, most were not utilized in standard practices. And unfortunately, this just comes down to the society and how things are done in North America. If a new drug comes out that significantly improves depression within 7 days and has no side effects, how many doctors do you think are going to hear about that? Just about every doctor in America is going to hear about that up front and is going to know about it and is going to know the cost, etc., and all the things about this drug. Now, if a new treatment modality comes out, for instance, a form of exercise that helps depression just as much as that medication, but has no side effects, how many doctors do you think are going to hear about that? Very few, unless they are listening and tuned in to the medical literature piece that published this. Because there's no exercise physiologist paid to come to the doctor's office and present the latest findings on how to exercise. And so often, many of these modalities had been rigorously tested in scientific fashion, but yet were not being utilized simply because the practitioners were not aware of many of these modalities. I began utilizing these measures with wonderful results in my patients that actually went beyond what my expectations were. I wasn't really expecting to see the results that I got. And once the program was utilized, many patients who had been chronically depressed for years were no longer depressed. They came back talking about how they were thinking better, how their lives had improved with their spouse, with their children, how they actually had much more energy and they were able to accomplish much more. These were quotes that I got that first year that I began to implement this program in just my own patient population. You've given me my life back. One man who had not seen me at all before, after this occurred, came in because he wanted to meet me and he said, "You've given me my wife back." This was the wife that I had married, he said, and I had lost that wife soon after we got married. And he wanted to come and just tell me how much he appreciated it. And then this, "Doctor, I hope you don't mind, but I'm going to hug your neck," was common as well. Then I began to, after this great improvement, I began to think, you know, these people are so much better, I wonder if we can withdraw the medication. Now, I must admit to you, the studies show that if you withdraw an antidepressant medication from someone who has been depressed, they have a high likelihood of relapsing back into depression because they are dependent on the drug. And so I began to carefully attempt withdrawal, and I found a 90% success rate in those who adhere to the program of being able to withdraw permanently from their antidepressants without going into a remission. This told me that we had found the underlying cause, and that underlying cause was no longer operative in the patient, and thus they did not need the medication. In fact, what had happened is they often felt better than they had felt their entire lives after being withdrawn from the medication. Why is that? Because of the side effects of the medicine. And of course, when they were depressed, the benefits outweighed those side effects, and so they used it. But as their depression cleared and they were withdrawn, they recognized that some of their feelings they had were due to the side effects. They were getting more done, they were more efficient, their social problems would vanish, and they were able to concentrate and accomplish advanced planning and thinking, which a person with major depression is not usually able to do. They usually delegate their decisions to others because they can't concentrate in such fashion. And so I encourage you to learn about this comprehensive mental health education program. It will be an experience that will change your life for the better. It's an 8-week program. We have it one night each week. And that one night each week can be modified to fit your local needs depending upon your situation and the facilitator that is present. Depression, the Way Out, the book that I have written about our experience in this and all of the scientific backing for this, is the textbook that will be utilized. There is an accompanying workbook. After each one of the sessions, you will actually get into a small group with a facilitator, and go through workbook exercises and discuss these things and actually learn how to implement them for sure and consistently in your life. We will have trained facilitators and assistants present, and depression recovery is about making choices and building relationships that will enhance your life significantly in the future. There is bad news, though, as well. The bad news is there isn't much we can do about our genes or our development, is there? Although we can do something about our children's and grandchildren's development if informed enough and early enough. Actually, by going through this program, you're going to find out how you can raise your children and your grandchildren, even in regards to the food that you're feeding them, that can improve their mental health for the rest of their life. But once we're adults, our development is over with. Our genes are fixed. The good news is the other 8 hits we can modify in most cases so that depression can be cured in 5 months or less, even if our genes and upbringing was flawed. There can be a cure for depression. And I have seen it too often to just keep this information to myself and my own patients. Don't wait for depression's complications to occur. Depression is more than just sadness and apathy and fatigue. It can actually cause premature death, premature disability. It can cause chronic headaches. It can actually even shrink the hippocampus of the temporal lobe of the brain, which can affect our memory. The longer we're depressed and the more bouts of depression, the more our memory is also affected. Don't wait for those complications to occur. Get on the best pathway to health of mind. Register for the Wellspring Depression Program today. Do the important workbook exercises and implement the thoughts that will change brain chemistry for the better. When you go through this series, we will actually show you how to do cognitive behavioral therapy on yourself. That's the type of psychotherapy that has been shown significantly to help mental health. The nice thing about cognitive behavioral therapy is it's been shown to change brain chemistry. And what we do is have you analyze your thoughts, know the 10 most common distortions, and actually get your thoughts lined up with what is true. And we'll give you example after example on how to do this. And as you consistently apply it, you will not only improve your mood significantly, but also improve your effectiveness in communicating with others and your total success in life as a result of going through what we now abbreviate as CBT. We'll have an entire session on that as well. Make the choices that will positively impact your life long term and get acquainted with this program. Thank you very much.